Hi, my name is Greg Glover. I'm a physician assistant with HighPoint Orthopedics. I got into being a physician assistant kind of later in life. Every job I'd ever had, I always felt like was just a job. I have an undergrad in science from Western Kentucky University and had several jobs in sales and various other aspects of industry, but I always knew that wasn't really where I was supposed to be. I'm always a believer that God gave us all talents to do something. We're supposed to use those talents to serve Him and fellow man, and I just never really felt like I found the niche. But one of my previous jobs is where I got in touch with, or got to learn more about being a physician assistant in the medical field in general. And one day I just went home and told my wife that she probably ought to think about being a nurse practitioner. She's an RN, and she said, no, if you want to go do it, you can go back to PA school. So I did. And like I said, I went back to PA school when I was about 35 years old and followed the program, kind of went unemployed for a few years to go through the training that I went through. And I've never looked back since. I really believe that I'm doing exactly what God asked me to do in trying to not only serve Him, but serve my fellow man as well. When I first got out of PA school, I started in the emergency room, started doing small procedures, went from there into a family practice. Generally, or training for as a physician assistant, you are licensed or trained as a general practitioner. So getting to understand and work with patients on their high blood pressure and their diabetes, as well as the emergency side of it, it really kind of led me to the path of finding a specialty niche, and that's where orthopedics fell into place. Being able to help people when they come into the ER, right from the very beginning, because that's usually when they're at their worst, they're not really sure what's going to happen. I like walking in and being able to explain to the patient, okay, this is where we are, this is where we're headed, this is where you're going to end up. Trying to give them as much education as possible so that they feel a little bit more comfortable about what they're about to get into. When I did choose the specialty of orthopedics, I got a chance to work with Dr. Roy Terry. He and I were together over here in the Gallatin area for several years before coming on board with the HighPoint organization. And it allows us to not only have our clinic time to see our patients to see most patients on a regular basis, but also to have the ability of seeing patients in the ER and also take care of patients while they're in the hospital as well too. When a patient comes into our office for any orthopedic need, whether it's follow-up from the hospital or surgery or coming in with a new complaint, one of the things that you can expect, especially from my standpoint, is I love to laugh. We love to have jokes. We love to have a relationship with each other, and I think relationships build trust, and I think trust is going to help with your overall health indeed. Healthcare to me is like a three-legged stool. You got a spiritual side, a physical side, and an emotional side as well too. And I think you have to treat all three aspects of that. And sometimes the best way to do it is through laughter. When I'm not at work, there are several things that I do enjoy doing. Both of my children, I have two daughters, one who is also a PA. She lives in Florida. We try to see her every chance we get. I have another daughter who's living in Cincinnati. And we try to spend as much time with them as we can, so we're on the road a little bit. And then my wife and I like to travel. My wife is also a nurse here at the hospital and works for HighPoint as well too. So we try to get away and just kind of unwind the best we can. Sometimes it's nothing more than going out back with the dogs and throwing a ball, but we do try to have some downtime for sure. I enjoy being in this area. I've been in practice here for over 10 years, and I've enjoyed really getting to be part of the community, getting to know a lot of people, have a lot of customers who like to come back and see me, a lot of patients like to come back and see me. I think it's very important to have relationships with people, and it's great to have an opportunity to do that in a local community where everybody knows everybody. Going to the grocery store or going to the restaurant and you run into people that you've treated or you've helped, and still getting a smile or a laugh is always a good thing to have. So I really appreciate the opportunity to continue to work at the community as much as possible.